Do you believe in miracles?
It doesn't take long for God to do a miracle in your life.
Welcome back here on Prime Morning. It's time for us to get into our conversation, which, of course, is good living. Every Tuesday, we make sure we speak about things that will interest you, yourself, your health, and everything that makes you the human being you are. So sometimes it's good that you also get to share your experience with us, so we're able to let our resource persons, who happens to be doctors here in the studio, help you. And today, I'm sure you're going to be getting some help if indeed what we're going to be talking about is something that you're suffering from. So I'm going to be introducing my guest to you in a couple of minutes, but as of 2019, over 18 million people around the world have had what we call the rheumatoid arthritis, and that's what we're talking about today. Now, 70% of those people that I'm talking about, the 18 million people, were actually women, and 55% of them were more than over 50 years. And so if you're looking at it, then it means that it's something that we really have to take our attention to and try as much as possible to see what is there, what's not, and how we can even make the situation better for those who are going through that disease. And so we're going to start off, by introducing our guest in the studio. Over here this morning with us is Dr. Kobina Biney is here with us. Doc, good morning. Thanks for making time for us.
Good morning. Happy to be here.
Great. And Doctor is the resident internal medicine, Kolebu Teaching Hospital, and he's spending time with us this morning here on the show. Sefako is also here with us. Sefako Zomelo Asaso. I got it right?
Yes, right.
Great. And she's also a survivor. She's a patient and a member of Global Rheumatoid Arthritis Support and Platforms as well. And this morning, she's also here with us to walk us through the process with respect to personal experience. Sefako, thanks so much for making time for us. How are you doing?
I'm fine, thank you.
You're better?
I'm good.
You're good?
Yes.
Awesome. That's good. All right, so we're going to start off. Doc, let's, before we even get to the main thing itself,
Right.
it happens to have fallen under immune system diseases.
Yes.
So let's take a look at autoimmune diseases in the first place. What exactly are we talking about?
So autoimmune diseases are a group of diseases which primarily is because your immune system is fighting against itself. So if you take a country like Ghana, and the soldiers in Ghana are supposed to be protecting us against intruders or foreigners.
Yeah.
But when the soldiers begin to attack the citizens, then you have what we call an autoimmune disease. So it's your body's immune system, which is supposed to be fighting off infections and other conditions, fighting against you. And there are an array of them. And depending on which parts of your body is affecting and depending on which immune cells are involved, the different disease entities are named. So for rheumatoid arthritis, it's under autoimmune conditions in general, but it mainly affects the joints and then the bones.
So it means there are others.
Oh, there are
all
lots.
fall under it.
Autoimmune. So there's lupus, systemic lupus erythematosus, there's scleroderma, there's dermatomyositis. There's a lot of autoimmune conditions, and a lot of research is still ongoing to find out why your body will fight against itself.
Okay. So it means that all those that you've mentioned all have to do with the cells and different parts of the bodies.
Exactly.
Okay.
Exactly.
But the arthritis, the rheumatoid arthritis is what
mainly affects the joints. Exactly. And this month is Rheumatoid Awareness Month. So for the different autoimmune conditions, there are months set aside so that we create awareness so that people know, because early treatment leads to a better controlled disease and less side effects and complications.
Okay. Yeah. So now let's zero in into the main thing itself. What it is and how does it come?
So as we've said early on, it's an autoimmune condition.
Yeah.
Affects mainly the joints, the small joints, and sometimes the large joints.
When you say the joints, which joints?
So the joints, I'm talking about the small joints of the hand, the small joints of your feet, so sometimes your elbows, your knees. So mainly, but it can affect any other parts of your body, And it's as a result of the cells, which is the antibodies, attacking the joint spaces and then the coverings around the joint. So for every joint, where the two bones meet, there's a cartilage which covers the bone.
Okay.
So it's like a pad, covers the bone. And then there's a membrane which goes around that. So when the antibodies attack the membrane, which is the covering
goes around.
Exactly, then you have the symptoms. Okay. So maybe that is the disease process. So people will present with painful joints, especially in the morning when they wake up. So they might complain of stiffness when they wake up in the morning, which gets better as the day goes on. So like for the 30 minutes when they wake up, they have the joint pain, joint stiffness, and then swelling. And sometimes they are generally fatigued. Okay, so that is the disease process. And the disease process leads to the symptoms. So Safako will tell us about how she feels so that we put everything in context.
Yeah. So Safako, Doc mentioned that, I mean, this is what you're going to be feeling, and then it progresses into something else. In your case, how long did you start getting that, and how did it happen to you?
Well, I was diagnosed in August 2015. Yeah, so that was when I was diagnosed with the disease. So it started with joint pains, fatigue. In fact, you feel very tired. You can't do anything. So it's the disease is invisible. So it's invisible, so you are fighting. So you outside, you don't see what I go through. But I'll complain that I'm having pain here. And people are like, but you look fine. So why are you complaining you are not well? But the thing is inside, you know how you are feeling. Yeah, so it's not something really cool.
The symptoms you're talking about, was it the initial stages that you started feeling that way? Or it comes this one comes today, the other one adds up? Or you just woke up one day and you started feeling the stiffness and the pains and all that?
Well, it started with knee pain,
okay. So you woke
swelling,
up and you're not able to stand.
Yes, you can't stand. And then you need somebody to help you because you feel stiff. So I didn't know what was going on until I went to the hospital. And the doctor, I was fortunate that I got a doctor who said, oh, I think I know your condition. I'll refer you to the rheumatology department. And that was where I was diagnosed. So I was very fortunate that I got diagnosed early. So that is it.
This was between what time in terms of when you got diagnosed?
Yeah, I think it was around a year.
So you had experienced that condition, the symptoms for a year?
Yes, and I had to use walking sticks at times to the office.
Wow. And that is even yours being diagnosed early.
Yeah, because I have, my leg is swollen, my knee is swollen, I can't walk, and you have to go to the office. And if you stay home and you said, I'm sick, it's like you don't want to come to work.
Yeah.
So you are forced to go to work. So I had to use the walking stick to go to the office, climb the stairs. And then
you're not even old, 70-year-old already. You're using walking sticks.
You see old. So I have to use the walking sticks for some time. So I was just doing it in and out till I went to the rheumatology department. And then the doctor said, okay, I need to do some labs to confirm. But then before she looked at my joints, she started and then touching it to just feel. So she said, okay, I know what this is, but let's run the test. So it came out rheumatoid arthritis. I was seropositive. So that was what came out. So that was when.
Okay. Doc, I'm going to get it to you to explain what she just said about her condition. But before that, let me find out what kicked in that made you decide that it's time for me to go to the hospital? Because all this while you were still trying to manage it, you're still adamant going to the hospital. At what point did it get, or what came into your mind? Was it fear?
I was scared because I didn't know what was wrong with me. And it was like people are getting tired of you in the office. Always, I'm sick, I'm sick. And they are not seeing anything. You come, you've made up, makeup, yet you say you are sick. So you go to hospital, you come back, and they are like, gossip. No, so you're back. So we're chinning. So you see, that's it.
So you also got tired of it and decided.
Yes, I got tired. So when the doctor said you should go, quickly I ran because the pain was too much. I couldn't take it again. So I went, and thank God I went early and I was diagnosed. So, and I was put on treatment.
Doc, 1 year is enough for somebody to say, I have come early. How long does it take for somebody to recognize that where I've gotten to, I need to go and check this? And what time is late time? And what time is early time?
So you see, as I said early on, the disease process is very insidious. So because of how the symptoms are like, so when you wake up, today you have some joint pains, in 30 minutes is fine. So you won't really chase it, you see. And as the disease process goes on, you begin to have distraction of the joints, which will lead to certain deformities of the hand, okay? And now medicine is evidence-based, so everything we do in the hospital is based on evidence. So there's evidence to show that the earlier the diagnosis is made, the less severe the complications, okay? So all this is part of raising awareness so that people will go to the hospital early enough when they begin to experience such symptoms. And also for the healthcare providers to also have a high index of suspicion of this condition so that when people come, then they think about it and they're able to do the tests required to make a diagnosis so that they can seek appropriate care. In Ghana, we have at the moment only 3 rheumatologists taking care of all people with these autoimmune conditions. Okay,
I see.
So like time from first symptoms to diagnosis can be long as 3-5 years, because sometimes people go to the prayer camps, they go to the herbalists who have no idea about all these conditions, and then they come when their complications have set in, and that is a bad or a marker of bad prognosis. Yeah.
Doc, let's look at the causes. Now, earlier you spoke about the cells attacking itself.
Yeah.
What would make a cell want to attack itself, which will lead into what we're talking about?
So generally the causes are known. We don't know what causes it.
Oh.
All we know are associations or things that have been seen in most people who have rheumatoid arthritis. Because in medicine, causation is a very strong word. So when we say this causes this, it's very strong. It means that when you have this, you will get this. But it's not like that in all conditions, and rheumatoid arthritis is part. But what we have known, or what we have seen to be associations with rheumatoid arthritis are: 1, genetic predisposition. So we have seen that in people with rheumatoid arthritis, they have certain genes. Okay, there are lots of them. There's HLA-DR4. There are lots of genetic predispositions. So that's 1, genetic. We also notice that some of them have certain infections. So they may have some infections in the past which tend to trigger the autoimmune process. So it doesn't necessarily mean that if you have this infection, you're going to get rheumatoid arthritis. But let's say you have this genetic predisposition, and then you have this infection, then that triggers it. Another thing we've noticed is there's a place for hormones. So we realize that rheumatoid arthritis is more common in females than in males. So there's a role for a play of hormones, because the difference between us and the females are the hormones. So they have more levels of estrogen as compared to the men. So there's a place for hormones. There's also a place for smoking, because it's been noticed that people who smoke are at an increased risk of having rheumatoid arthritis. So then people who have the genetic predisposition and then do smoke also are more likely to have rheumatoid arthritis. And then stress. So, I mean, as I said, there are associations. There are things that have been noticed in people who already have the condition, but we haven't established a specific cause to say that if you have this, then you get this. Like the way we know that malaria is caused by mosquitoes. So we don't have that, but we have these associations that have been shown to be linked with rheumatoid arthritis.
So it means that a person's lifestyle can be a trigger.
Yes, a person's lifestyle can be a trigger. If you have the predisposition and then you smoke, you can that can be a trigger. Cigarette smoking in general,
Sefako, in your case, what did the doctor say? Did you have any of these things Doc has mentioned?
For me, I think what triggered mine was stress.
Okay.
Stress. So that was the trigger for me.
How was your lifestyle like before you getting diagnosed and all?
I was very energetic. I could do everything that everybody is doing. I go to work early, come back late. You don't get enough sleep. Okay, so I think the stress was a part, on my part, the stress and other things that triggered it. But the most important is stress.
Okay, Doc, if stress can be a cause, and let's just say you have a certain lifestyle that you live in, you don't do checkups and all of those things, it means that such a person is at high risk.
Exactly, especially if they have the genetic predisposition. I'm showing a case, she had the genetic predisposition.
Okay.
But the trigger was stress. So we advise our patients to take it easy, prioritize what they have to do. So if they have to do 5 things in a day, we tell them to prioritize what's the one most important thing you have to do, and then you do that. Because we have noticed that when they are well rested or when they are less stressed, they have better outcomes and better lives. So we will rather that they have that. And one thing I didn't mention is the disease doesn't have a cure. It only has exacerbations and remissions. So we all hope that they will go into remission for a long time, where in remission the disease activity is very low, so you don't have any of the symptoms.
Okay.
But in the course of life, you can have a flare, which is like an exacerbation, where the disease activity goes up, and then they have the symptoms again, and then we need to go up on their medications, and then it comes down. So the disease is it's like that for most of the autoimmune conditions. They have periods of remissions where the disease activity is low, and then periods of exacerbations where the disease activity is high. So our goal of treatment as rheumatologists is to keep the disease activity very low, in remission. We hope that our patients will never have an exacerbation or a flare. They'll always be in remission. But as we see, they have flares from time to time. So another aim for therapy is to reduce the number of flares that they have.
Okay.
Yeah.
You're going to walk us through the therapy process for us to get to understand what exactly it means. But if you just join us here on the show, this is our Good Living segment. We're talking about rheumatoid arthritis. And we've got a patient over here who's Cephacol that has been, through the process. And she's creating awareness and all of that. So if you're also going through the same thing that we're talking about here, you can send your messages to us. Let us know what your situation looks like, the experience of being through that process, and how you are doing today. If you've got any questions you want to ask Dr. Biney is here with us. You can also ask the questions. He's going to give you all the answers that you need. So this is our topic for today. Doc, we mentioned earlier the stats actually indicates that the women are more. Apart from women, are there any other age group who can also get to this point that the women get to, those in that age bracket for them?
Yeah. So rheumatoid arthritis can affect the whole spectrum.
Okay.
So in children, we call it juvenile rheumatoid arthritis.
Oh.
So it can affect children.
The
So that's
ages of-
below 16.
Below
So below 16 is juvenile rheumatoid arthritis. And then we come to the adults, most commonly in people in their 30s. And then in adults like 50s as well. So it's it cuts across the ages, okay? And women are more affected, as you rightly said. So basically that's it with the distribution.
Okay.
Yeah.
Does it itself has types that, so A can be suffering from the same disease, but hers is on a different, stage. Another person could be going through the same thing, but also having a different, stage.
So I won't say types, but the expression of the disease may be different.
Okay.
So for some people, their expression is quite rapid and it's quite aggressive.
Okay.
And severe. And so they will have lots of the joint pain, destruction. They will have other comorbidities like heart disease, all from the rheumatoid arthritis. And for some people, it can be very mild. One thing that has been shown to affect how severe it is the time of diagnosis and the time treatment starts. So we do know that people who have had late diagnosis and late onset of treatment have more severe disease, much severe disease, as compared to those who have early diagnosis and early treatment, yes.
Safako, in your case, when you are now told that, okay, this is what you have, what was the first thing that came into your mind?
I said, thank God, I know now what is wrong with me.
Oh, that was what you were waiting for?
Yes, because I didn't know what was wrong. So if now there's a name to the disease, I should be happy.
But it didn't scare you by hearing of the name? Because it was the first time you heard that.
Yes, that was the first time I heard the name. So I was like, what kind of disease is this? So when the doctor told me that they have a support group that they have, so if I don't mind, if I can join. So I joined the support group. And then when I went, plenty people. So I realized that I'm not the only one. I have other people suffering the same disease, or if not, different levels. So that was relieved. I was really relieved that I found a cure. I was diagnosed, and then lots of people, my colleagues or my friends, we call ourselves Oman. So we are a family, so that's it.
And that's how your treatment process started. We'll look at your treatment process, but when you heard that and you realized that there were others who are not family related, but they are family in terms of group, who also have it and you were a bit relieved, did you now start thinking that, so since it's genetic, can any member of my family have it? Let me just go and make some inquiries and find out if anybody has it. Is there anybody like that in your family?
Yes, so first I made my mom go around the test, and it came out negative.
Okay.
Yeah, so she wasn't. But recently, I was told that my big sister also have arthritis. Okay, so I was like, okay, then there's something here. So there's a connection there. So that was it.
But Doc, if the mom is negative, it could be that the dad is positive?
Not necessarily. It's not one that is like transmitted, so that if your mom has it, you also have it. The genetic bases are quite complex, and it is not like there are other conditions where if your dad has it, you will have it, because the transmission is, there's a dominant form, there's a recessive form, so patterns of genetic traits transition from parents to children are quite complex and are different per every disease condition.
Okay.
So it might not necessarily mean that when your mom has it, you have it, okay?
Okay.
So there's that, okay? But then that said, there's how we diagnose people with rheumatoid arthritis, because not every joint pain will be rheumatoid arthritis.
Exactly.
So there's a criteria that we use, and it's based on evidence. So it involves your clinical history.
Okay.
So the symptoms that you have, it involves things we find when we examine you on examination, and there are things, the last one is the investigations of the test. Okay. So when you fulfill this criteria, then you're able to receive the diagnosis of rheumatoid arthritis, and then you're able to proceed with management.
Okay. When you have patients coming to you and you diagnose them and they realize that this is what they have, usually what's the reaction like?
So, as with any disease condition, especially for this disease where, one, we don't know what causes it, two, it's a chronic condition, which means you're going to be on medications for almost your entire life, and three, the uncertainty that comes with it, that you may be having flares along the way. Patients are often distraught and they are often sad at the diagnosis, and that is expected. And so because of that, we have a good counseling unit that takes the patients through the diagnosis. We also do have a support group for the patients where they're able to identify with other patients who have similar conditions, so that they realize that they are not aware. From time to time, we organize educational workshops and good living series for the patients so that they feel good, they feel okay, and they feel like they are part of the community. Because we have seen, data has shown that there is a positive correlation between support groups and then how they do well in the disease activity. So we do help. And more can be done.
Okay.
Exactly.
Yeah, we'll look at the support system and how we can improve it. But Sefako, let's look at your journey throughout the treatment process. How did it go with you?
With the treatment?
Yeah, when you begin treatment, and you know how difficult it was.
It wasn't easy from the beginning. I'll get flare up.
Oh, you got to that point.
Oh, yeah. Right now, as I'm here, my knee, it's hurting.
Really?
Yes, so...
You're not in pain. We don't see...
That is the thing.
We don't see you in pain.
That is the thing. So people don't believe it.
Yeah.
Because you try as much as possible to hide it because it's invisible. Unless it's swollen, then you can see.
Do you sometimes get to that point?
Yeah, it does.
Even till now that you're on treatment?
Yes.
What do you do that makes it swell? Now we're not seeing the swollen knee now. What makes it swell according to what you've been told? It just happens?
It happens. So I think, when you go to the doctor, then either they'll increase your medication or decrease or add something to help you get relieved.
How often does it swell, let's say in a month?
It's been a long time I had knee issues until this January. It started January. So it's been on and off, yes. So the knee issue is back. So I'm in contact with my doctor to find solutions to that. So I know she will come out with something to relieve me.
So your treatment processes took you to a hospital in and out like almost every time?
Yeah. It took me to the hospital, admissions. I've been on admissions several times. There was one admission that, honestly, it was very difficult. Everybody was scared that, hey, what is this? So I had to do this treatment that really saved my life.
What treatment was that?
It's rheumatism, what's it?
The Paulson.
No.
Rituximab.
Yes.
Rituximab. Doc, help us. What is it?
So rituximab is a biologic. When we say a biologic, they are made to attack the antibody that causes the disease.
Okay.
So it moves a step further, okay? And it's more targeted. And so it's more expensive.
Okay.
And not many patients can afford that. Exactly.
And that can kill.
It doesn't cure, it reduces the disease activity.
Yeah, I mean, that can take someone's life.
Sure. I mean, yeah, if you have like an increased disease activity level, yes, it can affect, your mortality rates will go up. But science is evolving, more research is coming, we are getting to know more about the disease. And so because of that, we are finding more solutions to the disease. So rituximab it's been around. I mean, in the West it's been used. But here, the cost is about 30,000 cedis per treatment course. And you might do that twice a year. How many people can do 60,000 a year for this treatment? So it's quite expensive because it's very targeted. Unlike the other forms of treatments, which are very broad. For example, because your immune system is up, we need to dampen your immune system. And we do that by using steroids, like prednisolone. There are other steroid-sparing drugs which will reduce your immune system. There are also disease-modifying drugs, okay? So not only will they reduce what's going on, but they modify the disease. And there's a whole spectrum of treatment options, okay? And all this comes with cost. And it's not covered by national health insurance. And so patients have to pay out of pocket. And so it makes the treatment expensive. And we need to also monitor the disease activity with time. So you need to be coming to the hospital. We need to be doing lab tests. All that's money. So it's quite difficult for the patients. Apart from the psychological stress, there's a financial burden as well. And then there's also the uncertainty stress as well, not knowing what tomorrow holds. Exactly.
I see. Sivako, so in your case, how did you move past, that treatment?
So thank God we were able to get the medication, and then we had the treatment. And honestly, when I had the treatment, I could feel good.
Okay.
Yeah, like the pain, everything just came down. I could now get back to my normal life. You see, so that treatment really saved me and took away most of the pain I feel. Yeah.
Did it scare you that if you're not able to go through that treatment, the worst can happen?
I was scared, yes. I was scared. I was really, because I was in pain at that time. The pain was too much. So it was good.
How long did it take you to complete the early treatment stages?
I'm still in treatment.
Also, you're going to continue?
Yes.
treating
Yes,
to
so
whenever.
yes, so I'm still on medication. I take medicine every day. And you can take like we call it cocktail. You can take about 10 pills.
In a day?
Yes, some people take more than that.
Whoa.
Yes, so you get your pill box, you put them in, and then you do morning and evening, depending on
The
the ones.
prescription from.
Yes, that's it. So
And you're gonna do this
forever until you go into remission. That everybody is praying for.
never to get there.
No, we are praying everybody to go
to
into remission.
Okay.
That's our prayer.
That's when you know that
the disease is at its
down.
lowest. Yes.
Yeah.
So we are all praying to go into remission. That's our prayer.
you see yourself getting there based on what treatment you have done so far.
Yes, with the help of God. I'm hoping to get there. I'm praying towards that. And I'm doing what the doctors want me to do. Yes.
Does it sometimes affect you? It puts you in a bit of depression that, why am I going through this? Why am I supposed to be
Oh, yes.
doing this?
It does. It does. At times, when you are in pain, you are like, you start to question God and all that. So you question a lot. But then you have to find ways and means to cope. Yes, to cope. So that's it.
I know it comes with its own effects, especially having a normal life and then you transitioning to now cutting a lot of things off because you're unable to do so. What are some of the things that initially you can do, but now because of this, you're not able to do?
I miss my high heels.
You can't do them high heels again. Eh?
I miss my high heels.
You were a high heel person.
Oh, I could be in the whole day. That's one thing I miss. Seriously, all my shoes are, they are going bad because I can't wear my high heels.
They hurt your knee when you wear them.
No, my feet under. It burns. I feel this burning sensation under my feet.
It comes with what
Yes,
you're going through?
Yes, I think my nerves. So I can't really wear the heels, which I love. So I have to do sandals, something flat to move. So that's it. I miss it. I miss it so much.
Know.
Oh.
I know.
You know, one day I went to one department and I was wearing my flats. The way the girl looked at me, and she was in high heels, I came back and I told my colleague, can you imagine? This girl was looking at me like, but who is this person? Me that can wear high heels. Yeah. And she was looking at me up and down. That day, I didn't feel good.
You've left all the 7 and the 6 inches and all the inches there. And look at now.
And now, I can't do them anymore. So that's it. That's it.
Doc, we'll look at your family support. Yeah. I don't know how it was like for you, but Doc, the people who come, for treatment and all of this, when they're diagnosed, does it become a problem with family? Do they come and tell you that our family people are not being there for us the way they're supposed to? Yeah. Friends and, acquaintances.
Yeah. There's very much like a lot of chronic conditions. With good support, the outcomes are better. So if you have a good family support system, friends supporting you, your work supporting you, you get better. But that's not the case for most people. And that is why we have the support group to actually serve as a form of family so that they feel they have someone to talk to and people to help and people to share in their pain when they go through it. So I can really relate to what she's saying. It can be difficult, but we let them understand that even with RA, there's more to life. There's more you can do. There's life beyond the diagnosis of RA, and remission is very possible. In other places, a lot of patients are in remission because they are on good treatment, they are on good therapy, and so they are in remission. They only have very few flares. Even when they do, it's well managed.
Yeah.
Okay. So I mean, it will take some time. People will have to understand, and with better understanding will come better compliance in the medications. better support, and then we will see good results and good outcomes.
Sefako, in your case, who was there for you?
My family, they were very supportive. From my mom, my siblings, they were really good. Yes. My support is, especially my care provider, that's my sister Jane. She's been with me throughout, on admission, everywhere. She'll be with me. And if I'm in pain, she'll boil water for my joints and other things, rub my back. In fact, she's been super, super good. Yes. She's very, very good. And I really appreciate her for all that she does for me. Because at times when you are not well, it's very difficult. Yes, because you can't do anything. Even to take a bath, it's difficult.
They have to carry you.
It's really, and even if you manage to go to the bathroom by yourself and you finish and you get to it's like you've packed thousands of cartons because you are really, really fatigued. You can't really do anything. So, in fact, she's been very good. The family has been very supportive. And I want to tell her that I love her for all that she does for me. Yes.
That's your big sister?
Yeah, that's my big sister. Yes, that's my big sister. The family has been very supportive. And then in the office, I have some people who say they understand you.
They claim they do, but
yeah, some say
they don't.
Some claim they do, but then behind your back,
yeah, that's a different story.
A different story. So that one too, they are there. So I appreciate them all the same. Yeah.
Does it get to you that you have colleagues like that who, under normal circumstances, should be seeing your condition and be real with you? But unfortunately, these are people who sort of pretend to be real with you.
Oh, yes. I had one boss. She's no more there in the office. Someone told her that I'm not well. And the person said, oh, this Sefako, she's hardworking. And said, yeah, I can't say in there, I see she was once hardworking.
That would hurt.
Yeah, so in fact, I was really hurt by what she said. I was really hurt because, yes, I'm not lazy. I come to work, do my work, and then, So if something has happened, you don't just start by saying, I'm lazy or something. Something happened before I got into this state, And those who complain behind your back, you said you are sick. You have given excuse duty. You come back to the office, all looking beautiful. They are not seeing the pain. So they don't even believe that you were sick. But you just show up and you are looking all fresh, like nothing happened. Because you hide it. If I'm not well and I'm walking, you ask me, how are you? I respond, I'm fine. But deep down, it's not well. But I don't want to tell you because if I tell you, you don't believe me. You rather go spreading it. So it's like, I'm fine. So it's really difficult. There are a whole lot of things behind your back.
Has it affected your friendships? Have you lost friends because of that? Because they get tired at a point. You're always complaining.
I'm not the friend type of person.
So that's a good one for you.
Yes, I just have some few friends that I really know are my friends. But when it comes to outing, honestly, you cannot plan with me to go out because the moments I can be sick, the moments I can have a flare-up, I can have this small finger will be hurting me, and I cannot do anything by myself. So if you plan me to have something done, that means I'll disappoint you. So I don't let people plan for me. I plan myself. So I just go by my own terms to do everything that I want to do. But I don't let people push me into doing something. If I'm tired, I'm tired. I just stay back. That's it.
Your eating pattern, has it changed? Has the disease changed anything in terms of what you eat?
No, I eat everything.
Okay.
Yeah, for me, I eat everything. I eat everything.
Doc, medically, it doesn't do anything to her in terms of what she eats?
No.
Food doesn't add or take anything away from what you're going through?
No, but we do know that there are some foods which have high anti-inflammatory property. And because of that, it can help when they have all these joints pains and everything. So in their sessions, we have a dietitian who speaks with them and gives them information about all they are supposed to do with respect to food. Also exercise. We teach them the kind of exercises they should do to help them with the joint pain and also help them move, because sometimes movement makes the pain better for them. So yeah, it's comprehensive, and diet and exercise is part of their management.
Okay.
Yeah.
Is there a connection with this as far as rheumatism is concerned?
So rheumatism is generally joint pain, basically. So you realize that there are other conditions that can give you joint pain or bone pain, like sickle cell disease can give you that. And then people will say, oh, my rheumatism has come.
Yeah.
So it's basically joint pain, basically.
Okay. But this is an extreme.
This is arthritis. It's a rheumatoid arthritis. It's a different, it has a different, let's say, physiology, different pathology to it. Although we are all having joint pains. What's causing mine is different from what's causing yours.
Okay.
So we have osteoarthritis, which is one of like the elderly from wear and tear. That's different from rheumatoid arthritis, which has the immune process as what's causing it.
Okay. At what point does it get that doctors would look at a situation and say, this person's life is on quote-unquote life support? It means the person won't be able to survive it.
Right. It depends if you have other systems involved.
Okay.
Generally, rheumatoid arthritis doesn't have a high mortality because it's like mainly the joints. But as the disease progresses, it goes on to affect other things. And the disease has like different entities where it can affect other parts. Okay, so it can affect your heart, where you have some form of, let's say, heart attack, because your vessels are all involved with the inflammatory process. So when it gets to that point, then we do know that your risk has significantly improved. And so because of that, your treatments will be much higher, and then your prognosis will not be that great. But generally, once on treatment, you can live a normal life. You can do all that you have to do, and then you're going to be all right.
Okay.
Yeah.
So it doesn't look like something you have to be seriously scared of.
No.
As long as you're taking your medications, you're getting your treatment right, you'll be just fine.
You'll be fine.
Okay.
You'll be fine.
Let's talk about how expensive it is. I'm sure by now your money all is gone.
It's expensive because you have to do labs. When you see the doctor, you have to do labs because she has to be monitoring your kidneys, your vitals, your vital organs. She has to monitor them. So when you go for reviews, you are giving labs, you are giving medication. So, and the medications are expensive, and then the labs, they are expensive.
Doc.
Yeah.
How much would it cost?
Well, it depends. But clearly, it's a lot because it's not something you budget for. And as she rightly said, every time you come and see us, we need to monitor the disease activity. We need to monitor for complications of the medications you are on. So apart from monitoring for the complications of the disease, we also need to monitor for the complications of the medications you are on, because some of the medications we use in treatment have side effects. So you need to do all these labs. You need to get all these medications, and as we said, it's for life. So you'll be taking these medications. So it's an expense that needs to be taken care of. So it's expensive. And with the newer medications, which have good outcomes, they're even more expensive. Okay, so roughly you're looking about $200,000 a year. How many people can afford that with respect to all of this, But then we try. And TRY is our support group. It's our NGO that stands for the Rheumatology Initiative.
Okay.
That tends to look at how we educate our patients, how we do patient advocacy, and how we do research into our patients who have rheumatological conditions, autoimmune conditions, so that we can have better outcomes for them as a people, as a nation, as Ghana. Because we have noticed that most of the time, the research that has been done, it's in other populations, which may not necessarily have similar characteristics to our population. So it's important that we do local research, we observe our local patients, and look at what works, what doesn't work, what are the peculiar things which pertain to us because of our genetics, so that we are able to better inform and come up with better better solutions to the problems that we have. So TRY is a non-profit organization that seeks to educate patients, raise awareness about autoimmune conditions, and then do research to support all autoimmune patients in Ghana.
Okay, so how does one become part of it? Sefako, are you part of the
Yes.
the group?
Yeah, she's part of TRY.
I'm part of it. Yes, so we try to raise for this year's awareness. We are trying to raise funds so that we can support the people who are on admissions, and then for those who cannot afford their medications. So that's one of the main reasons for having this support group. Yes, because there are a lot of people who cannot afford the medication. And then the doctors have to help with the money in the account of the support group. So we need lots of money. That's it.
Yeah.
So if there's someone who wants to support us, they can send the money. Should I give the account?
Sure.
Yeah, so if you want to support the initiative, you can send the money to 024 1929 775. 024 1929 775. We appreciate your kindness.
You can get in touch with us on all social media platforms.
Okay.
It's the Rheumatology Initiative, TRI, the Rheumatology Initiative. Yes.
It's on Facebook,
It's on Facebook, on Instagram,
Yeah.
it's on X.
and all that.
Yes. So when you come to our social media platforms, you'll get to see the work we are doing to raise awareness, to educate people, and the researches we are doing to improve the lives of people with rheumatological conditions in Ghana. Right.
If someone is in this condition, can the person still be a happy person?
Yes.
I don't know about Sefako.
Sefako,
Sefako, do you party a lot?
Oh, I'm a happy person. I wouldn't let this put me down. So I have developed my own coping mechanism. I love pictures a lot.
So you take a lot of
lot of pictures.
Look at that.
I take pictures a lot because, in fact, this cannot stop me. Life still goes on.
Right.
So any moment I take my phone, I'm gone. Photo shoots, I go and do. I just make myself happy. Yes, because what else again?
Yeah.
Yeah, I make myself happy. If I can go out, I go out. If it means I have to go and spend on myself, I go and eat on my own just to make me happy. For that one, there are no two ways about it. Yes.
Have you, at one point, or even now, been talked into seeking other ways of getting this out of your life completely? And I'm talking about the spiritual aspect of that. Do you get people say, it's a fact of this thing, if you go to this pastor or this prayer session, it could help you get into it? Or maybe some people who believe otherwise will say, I have a certain malam that can help you. Can help you, because trust me, there'll be so much relief if it's gone completely, which happens because miracles do exist. You understand?
Yeah.
So I'm asking if someone had ever talked you into it, even from the early stages.
No, honestly, thank God I have a supportive family, and they are Christian. So they wouldn't even, you dare not even come and tell us that there's a malam here, there's something here, go and seek help. No. My caretaker, my care provider, That one, dear, she will not even entertain that. So I've not heard anyone say, go here, go here. No, 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 no.
But do you sometimes think about it yourself?
No.
Can I take a bold step, speak to my God and say, God, I want this out of my life?
Oh, yes.
Do you sometimes think of that?
Yes, I do, and I always pray to, I'm a Catholic, so I always pray to Mother Mary to intercede always for me so that I'll be healed completely. So that's one thing I do.
You're hopeful of that?
Yes, I'm hopeful. And I always make sure I pray my rosary every morning before I leave home, just for strength. Yes, so that's it.
I see. It's not that bad. It's not that bad. Doc.
It's not that bad.
It's not that bad.
When you are praying, to pray that we find the solution.
Oh, yes, yes, yes.
If most,
Doc is interested in taking the bed out of it.
if most people pray
by finding solutions
for
to
times,
it.
it's like the way they pray for their problems. So we'll go past a lot of things. Because, the advances in science directly have an impact on the prayer topics that we have.
Absolutely.
50 years ago, the way people pray about malaria, malaria is just 3-day pill and then you're done in Ghana.
Yeah.
When you have malaria, nobody's going to fast and pray. They just take the 3-day pill and then they're okay.
Yeah.
So we are hoping we get to the point where cancer, rheumatoid conditions, lots of conditions will be 3-day pills or 1-week pills.
Yeah.
So that they don't have to
At least.
but they pray about other things. But for that, they should keep praying. And we advise our patients to seek help and support from wherever they deem fit while they still be on their medication.
Yeah, which is key.
Which is key. Because I think it's the holistic management that we look at, not just the orthodox part, okay? For example, they want to still pray, do their... That's fine. It's important. You need to do that. But you need to take your medications. What we don't advise for is when you take other medications because of the drug-drug interaction which may happen. Yeah. Okay. But for spiritual support, we encourage people to...
Okay. This one says, Lamine says, good morning. Respect to you, woman, full time. Okay, so Lamine sending respect to you. Safako. Franklin says that, good morning. Franklin here watching from 37. Kudos to Dr. Biney and Safako. Keep up the good work. All right, so you can also send your messages to us. Let us know what you think about this disease we're talking about. If you've got an experience you want to share with us, you can also do same and let us know what your condition looks like, the support you're getting. Is your support system enough to keep you going throughout the treatment and all the things that comes with it? You can let us know about it. Our WhatsApp line is active. You can drop your messages over there as well. Doc, very importantly, can this hinder, in terms of limitations, someone from having children or being with a partner or having sex or anything like that?
Directly, no.
Okay.
No. It will not affect you from having children. It will not affect you from having a partner. The only thing is that you may be tired for most of the time.
Okay.
And so your activity is limited. Okay. So you may have certain limitations, but you can live a full life. We also do know that sometimes, because of the medications we will put you on, you may not be advised to have children for a particular time, because the medications may be directly teratogenic or may affect the child. So we'll put you on hold for a bit, get you into remission, and then you can have your baby. There are lots of patients of ours who've had children, living good lives, healthy lives, to their full potential. Okay, we just tell them to take it a day at a time. They're different. Okay, people cannot understand, and that's okay. But they should take it a day at a time, and then it'll be fine. So you can live life to the full potential, just like anybody else, on your own terms. It may be different, but you can live life to the full potential. Yeah.
Then again, you would have to also consider whoever that is coming in. I don't know about you. If male friends come to you, are you worried about what it's going to generate into when likeness sets in? You're worried that this person may like me, but eventually may start withdrawing based on the kind of experience that person is going to have with me. Do you get to that point?
Well, if someone should come in, I have to study the person before I even tell you what is wrong with
They may
you.
even want to even come in as friends.
Yes.
You know, and all that. But knowing your condition, you may think that even the friends will get tired at a point.
Yes.
You know, so that even comes to your mind before it even generates into anything.
Yes.
You're like, you see, you can be my friends and go the next day because really.
Because if you are, let's go out. I'm tired. I cannot go. I'm fatigued. Let's go. I'm fatigued.
Yeah.
And if you don't understand, the door.
Oh. Looks like you're always in a hurry to show them the door.
Because I don't want stress. Because that's why I said I always do things on my terms.
Yeah.
Yes. But then I can be considerate for whoever is in. Yes, I can be considerate. But then you shouldn't come and stress me.
They would have to understand you.
Yes. Yes, they have to understand me. And then that's it. You have to understand. And be supportive. Yes. So I always pray for good people to be around me, genuine people, not pretenders to be around me. And when I say I'm not feeling well, they should know. At least they should have signs that when this girl comes to work, today is not looking good. They should understand, because at times you can monitor people and see what is wrong. Even if the person haven't spoken, you should be able to know that the person is not well. So I always pray for such people to come my way.
Ever since you started going through this process, you've had to keep just one job. You never had to lose a job because of that?
I've worked for like, is it 16 years?
Same company?
The same company, yes.
Wow, that's good.
Yes, the same company.
That's good.
Yeah.
Dog, that's positive.
Yeah, that's positive.
She's never had to lose a job because of a condition.
Some people have.
Some people have,
Some people have. And some people, too, it's difficult getting into a good job role because work can be demanding, and not every employer will be understanding to the point where they'll be willing to give you enough time off, paid time off. So it can be difficult.
To say a little to that. It hasn't been easy because, honestly, it's really tough. I once had a good HR. She really understood me. She was just perfect. But then others don't. They don't really understand you. So if you are sick, what? Everything must go on. But there are times that you can't move your body. You can't move your body, but you have to be at the office. I once experienced, in fact, getting to, this is 2024, yes. I had to really fight just to save my job. Wow. I really went through a lot because, which I cannot say on, but I had to really fight for my job. I really have to fight for my job.
I know. But the good thing is that you're still looking pretty, you're still healthy. You're still being you, and we're excited for you. We are glad that you've been able to stay on this journey and you continue to stay on it. We're very hopeful that you get to remission, which we're all going to pray for. And once you keep on with your medications, we know that definitely things will get even better than they are right now.
Yes.
So just don't give up yet. Keep up the spread that you've always done, the support system and everybody that is contributing to it. I know they will always be there for you.
Yes, sure.
Doc, we got to be going, but
yeah.
I say thank you to you. Any other thing you want to say quickly?
So basically, I'll advise people in general to take their health seriously, do yearly checkups, visit your health provider regularly, and know what's going on with you. Knowledge is power, and so when you know what's going on, then you're able to seek early treatment and then less complications and less side effects. So thank you very much.
Thank you so much. Dr. Biney, Kobina Biney, has actually, been very, very helpful to us this morning. He's explained everything we need to know about this disease we're talking about. And you, I'm sure, have been able to also pick few things that will help you in your journey if you're experiencing it. If you have not gone for diagnosis yet and you are having the symptoms, it's a decision for you now. Your decision time is now. The earlier, the better. And we all know that. Sefako has been an incredible human being sharing her story with us here on the show. show, and we appreciate her so much for coming through and all the support system that are helping. And of course, tomorrow is love, so we're going to be showing a lot of love, and 12 Days to Vows Day is going to be wrapping up here on the show. So tomorrow's morning show is all about love, 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 and it's all about Vows Day. Now, Big League Sports and Game Center, it's a lounge that when you go there, you get to play games, you get to drink, you get to have food, and trust me, we're there over the weekend, and it's an amazing place you want to be. There's snooker, there's table tennis, there's, and they're all centered in the middle of the restaurant. So whilst you're drinking and people are talking, others are playing games, and I love that place, and I want to be there tomorrow. Tomorrow I'll be going there again to bring you live, coverage of what we'll be doing here on the show. Rosalind Felly is going to be with me as well. So yeah, it's a good time. Please go there. They've got some packages for you for Valentine. It starts from 500 cedis. We have 800 cedis. We've got also 1,000 cedis. So it's what you want and what you want to do for your partner out there. It's the number you can call for reservations on your screens is 053-266-9392. And just go to Osu. That's where you can locate them. Make your reservations, go there, and have a good time. I can't wait to see you there tomorrow as we celebrate Valentine's Day. Kobina will be in concert tomorrow evening as well, so make sure you also come through and enjoy the very best.